Preventative health is something that's on the minds of many people, but often not so much for people who might be uninsured or underinsured, because they assume that those kinds of screening processes and things like that aren't available to them. I'm here with Rajeen Kugler, public health nurse with the DuPage County Health Department, here to emphasize that that is not the case. Rajeen, tell me a little bit about the Y-Weight program for those kinds of preventative screenings.
Okay. The Y-Weight program was initiated in 1995. It is a grant program, an agreement between the Centers for Disease Control and the state of Illinois. In 1995, they chose 4 sites in Illinois to pilot the program. DuPage County Health Department was one of those sites. The program, we screen women 35 to 64 years of age for cervical cancer. For breast cancer screening, we serve ladies 40 to 64. We also see ladies who are younger if they've had a recent abnormal Pap test or mammogram. Also, we do see ladies who are older than 64. There are eligibility requirements. Ladies who are interested in our program, we really encourage them to give us a call, and because it's by case only. Some women would qualify depending upon some of their situations, where some other women we may need to refer them maybe to another provider. The majority of our ladies have no medical homes. That is not an uncommon thing in DuPage County.
Right.
Also, some women may not qualify for the Medicaid card, and they also don't have financial means to be able to afford health care insurance for ACA. In those situations, we would be a very excellent option for women. The goal of our program is to detect breast or cervical cancer in early stages, the very earliest stages.
Exactly, and for those who do have medical insurance, their primary care physician is available to reinforce that, the importance of being screened, every year, that kind of thing.
Yes.
And I think a lot of people who may not have that available to them, it's kind of, well, what's the point? I can't. So
Yes.
it's great to know that that is available to them.
Yes. Also, women who have abnormal screenings, sometimes because of their health insurance, they have high deductibles. We can also serve those ladies as well. Our program specifically, we are concentrating on DuPage County residents. Other women in other counties within the state of Illinois, if they are interested in our program, they can contact the Illinois Department of Public Health Office of Women's Health Healthline, and they will refer women to their lead agency sites by their home. It's important that ladies are screened, and if they happen to have breast or cervical cancer, that they are treated close to their home, because when they have health issues, sometimes it takes a little while to get them healthy again.
Sure.
And again, we really stress early detection does save lives.
Absolutely, and if you have a health history in your family, that can increase your odds for these things.
Yes,
correct?
it can. However, the majority of women who are diagnosed with breast cancer have no family history at all.
Really?
Therefore, it's extremely important that all women are screened for breast cancer every year. For cervical cancer, we're talking about the Pap smear. Depending on the age, some physicians will choose to do a Pap smear and an HPV test together. Some only will provide or offer the Pap smear. For women who have abnormal Pap smears and HPV virus, our program would be an option for them because we can also pay for diagnostic testing. Other things that our program provides is that we do provide patient navigation services. We evaluate each woman for barriers to care. We're talking transportation, we're talking support. We do offer assistance with interpreting when the ladies do go see their providers. It's so important that women do receive this screening on a regular basis. That is why that we developed the video. We're trying to reach as many women as possible. Our video, what we chose to do is we are interviewing one of our ladies who was diagnosed with breast cancer about 5 years ago. She started our program at the very beginning of her screening process. She went through the screening process. She did receive navigation services. Once the lady, when she was first diagnosed with breast cancer, then we made sure that she connected with Access DuPage, because our role of our program is not just screening, it's also finding free treatment for all the women diagnosed with breast or cervical cancer.
And that's important that our audience knows as well, because I think that there's this attitude of what is the point in getting screened if I can't afford to get the treatment anyway? I don't want to know the bad news.
Yes.
And you're saying if the results are not good, you can help them through all the way through treatment as well.
Yes, there are 3 different ways. The first way is we have a Breast and Cervical Prevention and Treatment Act of 2000. That act states that any woman in the state of Illinois diagnosed with breast or cervical cancer automatically qualifies for the Medicaid card regardless of income. They will keep this card as long as they are in treatment. The majority of the time it's about 5 years for the ladies. Women who are diagnosed with cervical cancer or pre-cervical cancer conditions also would qualify for that Medicaid card through our program. They would continue to keep that card as long as they are in treatment. Once the ladies are no longer in treatment, then they would be responsible for finding their own health insurance. The second way is if our ladies do not qualify for that medical card, then we have a program that we have contracted with called Access DuPage.
Right.
Access DuPage, in turn, they partner with area physicians and facilities to provide free treatment for our ladies with breast or cervical cancer. If our ladies do not qualify for the Access DuPage program, the third way is that it is my responsibility to find these ladies free treatment in DuPage County. And what we would do is we would request free treatment from area physicians and facilities.
And does that usually happen?
Generally, that happens very infrequently. Usually the ladies either qualify for the Medicaid card or Access DuPage.
But I mean, as far as finding an option for women to get through the treatment and afford it, what is your success rate?
100%.
Really?
Yes. We have never had a lady that we have not been able to find free treatment.
That's wonderful.
Yes.
Now tell us a little bit about Antonia, who you feature in this video.
Okay.
What was her situation? I think there was a language issue as well, correct?
Yes, there was. She worked with our patient navigator, Sharita Bolarzik, and when Antonio came into our clinic for screening, to start the screening process, she had a breast problem. She saw our physician, we ordered the diagnostic testing, she was diagnosed with breast cancer. At that point, we determined, because of our eligibility requirements, that she would be able to receive treatment through Access DuPage. Antonio, she qualifies for Access DuPage, therefore Access DuPage contracted with an area physician, and she was able to receive her treatment free of charge.
That's wonderful. And how is she doing now?
She's doing wonderful. With this video, we also were able to address some of the barriers that a lot of these ladies have to care. Not only is health insurance a barrier to care, transportation, language, support system.
Sure.
And we also provide support and interpreting, services through our program.
That's wonderful. How can someone view this video?
We have it on our website at the DuPage County Health Department. We also have it on the YouTube.
Okay, that's great. So if someone wanted to get more information about the Y-Weight program, and I should mention if someone, especially if they've come from a different county in Illinois, it's also known by another name, is it not?
The Illinois Breast and Cervical Cancer Program, and also Y-Weight.
Right.
When we first received the grant for the program way back in 1995, they thought some ladies it might be a little more difficult to remember Illinois Breast and Cervical Cancer Screening Program just because of the length of that,
right.
The name. So we termed it Y-Weight program. So a woman can be receiving or be in the Y-Weight program from another county, move into and then move to DuPage County. It's the same program, and so that's important that women realize that as well. This program is available in all the counties.
Okay, so if someone has put off this kind of preventative care because they can't afford it, how would they go about qualifying for that? Should they just go to their local health department, like we have a facility here on Lake Street that's part of the county, or should they call?
That might be one resource for women, especially in other counties if they're interested, because a lot of the counties, the health departments are the ones responsible for implementing the programs, but not in all counties.
Okay.
So for DuPage County, it's important that they call the DuPage County Health Department, ask for the Y-Weight program. We do have an application that we request the ladies fill out. The application is very important because at that first initial contact with the application, we can determine some of her barriers that she may have to care. We can also determine if she was diagnosed down the road with breast or cervical cancer, what her options would be for her free treatment. We have contracted with 2 area hospitals, Northwestern in Winfield, Illinois, and also Good Samaritan Hospital in Downers Grove. We feel it's important that we contracted with several hospitals in DuPage County so these ladies can go to a hospital closer to their home.
Right, right. Transportation, as you mentioned, is certainly a barrier.
It's huge. Yes, it is.
How long does the application process typically take before they know that they've qualified to get these screenings, and then they're referred to these hospitals?
If the woman is between the age of 35 and 64, we can offer breast and cervical cancer screening services. As soon as I have the application, then they are a part of our program. Now, if they are a younger woman under the age of 35 or over the age of 64, we always take the ladies over the age of 64. With the women under 35, if they have any previous abnormalities, we may be able to provide services, because not only that initial screening services like the mammogram and the pap smear, but we also, our program is able to pay for biopsies, LEEP procedures, colposcopies, all the way up through diagnosis.
That's great. Well, thank you so much for being here, Rajeen. You can view the video, A Message of Hope, as she mentioned, on the DuPage County Health Department's website. You can get lots more information there as well, or you can view the video on their YouTube channel. Thank you so much for being with us, and please take advantage of this if it's something that you haven't done. Preventative screenings are so important.